And then several years later, his urine urgency got worse and his PSA moved over 4. And the doctors did a biopsy and found stage 2 cancer, which means people, which means guys, which means ladies. The cancer was there for at least several years. It could have been corrected, but he didn't know better. So you're having urine frequency or urgency because of the BPH or the enlarged prostate. You may even have prostatitis. This is the issue. The doctor is going to give you a medication that will help you to pee better. So when you go to the bathroom, your bladder can completely empty. That's the medication the doctor is giving you to help the urine flow to be better. That's all your urologists or your PCPs doing. That's all they're doing. They're not fixing the inherent issue in the prostate. These are the things that could be taking place in the prostate. Why you have urine frequency, urine urgency, enlarged prostate, prostatitis, or elevated PSA. This is what could be happening in your prostate, guys. You have an infection in the prostate, or the prostate is infected by viruses, bacteria, parasites, microbes, any of the above could be taking place in the prostate. But the bottom line is that the prostate is sick. And it means that probably millions of cells in the prostate are damaged or destroyed, which means that you have inflammation or infection in the prostate. Anyone who has inflammation in their bodies, in this case, the prostate, anyone who has infection in their bodies, in this case, the prostate. That infection can sit there until it damages the core of the cells, which is where the genes are. That's where the DNA is, where the genes are. So the medication your doctor is giving you is not to fix the infection, the inflammation. It's not to fix the damaged or mutated or malignant genes that are in the prostate. The medication is not for that. What the doctors have for that today, the treatment for a sick prostate, whether it's inflammation, infection, or cancer in the prostate, what the doctors are going to do is remove it, or they're going to do radiation, or they're going to do chemotherapy. Those are the standard treatments for a sick prostate. However, the FDA and the federal government will not allow doctors to just cut the prostate out unless the doctors see cancer in the prostate. They won't do it because they will sue them and they will lose their license. So all the doctors are going to do, give you the medication for the BPH or for the urine frequency or urgency to allow the bladder to empty, to have a better flow. So, guys, I see it every day. I saw it yesterday. A gentleman came to me. He had enlarged prostate for me, was in his early 40s, and he was taking medication for the flow of the urine from the bladder. He assumed, wrongly assumed, and I'm sure the doctor never told him that the medication eventually would fix his prostate. And then several years later, his urine urgency got worse and his PSA moved over 4. And the doctors did a biopsy and found stage 2 cancer, which means people, which means guys, which means ladies. The cancer was there for at least several years. It could have been corrected, but he didn't know better. All these men around the world that are losing their prostate in their 40s, 50s, 60s, and even 70s, it shouldn't be happening. It is happening only because of ignorance. So, yes, the medication for urine frequency, enlarged prostate, prostatitis will not fix the prostate infection, will not fix the prostate inflammation that caused the problem in the first place. So if you sit there in the medication, taking it, hoping that it's going to fix your prostate, that's how most of the men I talk to, thousands of men over the years, many thousands of men over the years, that's how they enlarge prostate, the simple issue that they could fix, lead to prostate cancer, and now they have to radiate their prostate or remove their prostate or go on chemotherapy. It can be avoided. Call New Species, tell your friends to get help from us, even if it's just for the education, just for the awareness. Please do that. And we are going to save We and you, when I say we, I mean you, New Species, who are watching or listening, and us at New Species, when we get this knowledge out there, this information out there to men and women, because women, you have men in your life. They're your sons, your grandson, your husbands, your grandfather, your father, your uncles, you have a lot of men in your lives, ladies. So you have to get the word out too to save their lives. And ladies, I can tell you, those of you who have men in your lives who remove their prostate or radiate their prostate, you know what's happening to the family life. At some level, the family life is devastated. And you know that it's a fact. And ladies, I know you will never talk about it. But he lose his manhood. He has ED, and in some cases, ED for life. And then the most embarrassing part of that, probably not the most embarrassing, but a very embarrassing part of that, a lot of these men have to wear Pampers for the rest of their lives. Devastating psychologically and spiritually. So the issues can be fixed. Enlarged prostate, urine frequency, urine urgency, rebuild the body. We can help you do that to make sure, at least to help you ensure that your body can help itself before it turns to prostate cancer.